Hi, I'm Malvika Rawal of Ideal Business Partners. Today is June 21st, 2017. I'm coming to you from downtown Las Vegas, and this is your Healthcare Minute. Now, the OIG, or the Office of Inspector General, announced last week that they will be updating their work plan monthly. Now, why do we care about that? The OIG is the enforcement arm of the Department of Health and Human Services, or the HHS. Its oversight extends to organizations like the Center for Medicare and Medicaid Services, the National Institute of Health, and the Food and Drug Administration. Every year in fall, the OIG releases a work plan, which basically describes the aspects of healthcare that it plans to audit in the upcoming fiscal year to improve the efficiency of the various HHS programs. And based on congressional demands, on whistleblower complaints, and the OIG's own audit efforts, they update this work plan about once or twice a year. Now, for those in the healthcare compliance community, the release of the OIG work plan is like getting the syllabus for the new semester. The next few weeks, all compliance personnel are pouring through the work plan and prepare their clients for the upcoming expected audits. Now, the OIG released the 2017 work plan in November of 2016. At this point, any healthcare compliance personnel worth their salt are completely abreast of the OIG's initiated, ongoing, and completed projects. Now, here's the kicker. The OIG on June 15, 2017, announced that instead of updating its work plan like once or twice a year, as they have been doing in the past, they will be updating this plan monthly. The decision is so that they can keep their audit efforts more comprehensive and dynamic. They also claim that this monthly update will help them to keep better tabs on bad actors and eliminate them from the federal healthcare programs at the earliest. However, a more dynamic and ever-changing work plan will abbreviate the amount of time healthcare providers, business associates, and their compliance officers will have to get their affairs in order. This will also increase the compliance officers' workload because they will be constantly monitoring for and responding to these monthly updates from the OIG. Providers will no longer have the luxury of a few months' time to get their affairs compliant to respond to an audit threat from the OIG. It would therefore be wise for providers, especially smaller private practices, to hire external compliance resources like ComplyPro to not only keep them abreast of the updates from the OIG, but to also ensure that their practices compliance is up to date. So this is your warning bell, compliance officers. You have to initiate a proactive culture of compliance at your organization rather than a responsive culture of compliance. So you can go to mycomplypro.com and request a consult today to help you in this effort. Thank you.